Hey guys, this is Dr. Hitesh and we are here to talk about a condition called hydrocephalus. Hydrocephalus is a medical condition in which there is an increased CSF volume inside the brain. The normal value of CSF in brain in adults is 150 ml and in infants is 50 ml, and greater than both of that value leads to hydrocephalus. Let's see the causes of hydrocephalus. It can be of two types, obstructive and non-obstructive. Let's talk about obstructive. In obstructive, first congenital anomalies like aqueductal stenosis, Dandy-Walker syndrome. Second, tumors like posterior wall fossa tumors. Third, infections like toxoplasmosis, which comes under torch infections. In non-obstructive, first reason is increased CSF production due to the choroid plexus papilloma. Second, decreased absorption from subarachnoid space due to subarachnoid hemorrhage and meningitis. Let's understand the most common cause of hydrocephalus, that is aqueductal stenosis. It is the most common cause of congenital hydrocephalus and most common cause of fetal ventriculomegaly in ultrasonography. Let's understand the pathogenesis. Normally, the CSF flows from lateral ventricle to third ventricle to fourth ventricle. Now, there is a stenosis in between the junction of third and fourth ventricle. That is called aqueductal stenosis. Let's talk about the normal flow of CSF inside the brain. CSF is produced by the network of blood vessels and specialized cells within the ventricles called choroid plexus. Right from the choroid plexus, CSF goes to the lateral ventricle to foramen of Monro, to third ventricle, from third ventricle to Sylvian aqueduct, and from through the Sylvian aqueduct to fourth ventricle, and through the foramen of Loschka and foramen of Magendie goes to subarachnoid spaces, and finally subarachnoid villi absorbs it. Clinical features. First, macrocephaly, that means increased head circumference. Second, increased intracranial tension. Due to this, there are dilated scalp veins, bulging anterior fontanelles, wide sutures of the skull, sunset sign, that means visibility of upper sclera due to the gaze fixation into the downwards. For screening, neurosonogram can help you a lot. And for the gold standard investigation of hydrocephalus is MRI brain. Let's come to the treatment part. First, there is a medical management, and second is surgical management. In medical management, we have to do the decrease the CSF production, under which comes like carbonic acid anhydrase inhibitors, diuretics, acetazolamide. And under surgical management, there is a surgery called shunting surgery, which is VP shunt, ventriculoperitoneal shunting surgery.